Joining me now is Dr. Vivek Murthy, former Surgeon General and co-chair of President-elect Biden's COVID Advisory Board, and Dr. Lipi Roy, internal medicine physician. Dr. Murthy, I'm going to go to you first. Are masks simply a feel-good measure that don't make any difference in the spread of the disease of COVID?
Well, it's good to be with you today, Joy. So what science tells us very clearly is that masks work to prevent the spread of COVID-19. It's not a source of debate in the scientific community. And if you also look at parts of our country which have put mask mandates in place versus those that have not, we've seen a slower rate of spread in those areas that have actually implemented mask mandates. So the message is simple. Masks work. We should be encouraging people to use them. We should be making it easier, in fact, for people to access effective masks as well.
And just to be clear, do masks protect, let's say, me from catching COVID, or do they primarily protect me from potentially spreading COVID, Dr. Murthy?
So masks actually benefit both the person wearing the mask as well as the people around them. There was a time, earlier on where the message that many people were getting was that masks only protect the people around you, but they don't afford you any protection. That is not the case. We now know that actually the mask can help everyone. So there's really no reason for us from a public health perspective to hold back on recommending masks. This is something that, again, we don't want to wait until it's too late to implement mask mandates. We're seeing some states do it now in the midst of this extraordinary surge. But really, this is a policy we should have in place everywhere because it saves lives.
Dr. Roy, let me play for you the South Dakota governor again, Kristi Noem. Just play a little bit more for her because she has been one of the most recalcitrant of governors in the entire country when it comes to mask mandates. Take a listen.
Let me tell you, my people are happy. They're happy because they're free. The governor in Nebraska, Pete Ricketts, Kim Reynolds in Iowa, and I have been making decisions to protect our people and let them use personal responsibility to protect their way of life.
Now, I'll note, Dr. Roy, that most of the people behind her do not have masks on. They didn't even do it for the pictures, the people behind her. The positivity rate in the past week in South Dakota, and let's do the comparison of South Dakota and New York. We'll put them up on the screen. South Dakota has a 56.34% positivity rate. New York has 3%. And New York City is closing its schools at less than 3%. Your thoughts?
Yeah, that's first of all, it's good to be with you again, Joy, and it's good to see Dr. Murthy again. The narrative, the messaging that the governor is sending to her people, not only is it false, but it's just downright reckless and harmful. She cares about the freedom of her people, and wants them to be happy. I don't know how happy they'll be if and when they get severely ill and get hospitalized and, God forbid, are in an ICU or put on a mechanical ventilator. None of that's considered freedom, right? And it's not a coincidence that the same state that refuses to mandate masks or even encourage masks, which we all know saves lives, it's not a coincidence that that same state has one of the highest, if not the highest, test positivity rate in the country. In stark contrast, New York City, which just approached the 3% test positivity rate, just announced school closures in response. That's government officials, elected officials making decisions based on data, speaking closely to their health advisors to make decisions to protect their people, Joy.
Yeah, indeed. And Dr. Murthy, we're seeing states sort of changing their minds and in some states moving toward it. But these are the states that are having new restrictions, and this is new as of this week. You have Michigan having new restrictions beginning on Wednesday, something for which the Republican governor is being threatened with impeachment. You have in Kentucky, Andy Beshear's Kentucky restrictions impact gatherings, schools, restaurants, and more. We have California governor pulling the emergency brake, imposing new restrictions on businesses, despite the fact that he did make the mistake of attending a party. And, not a good example that he set, the governor there, Gavin Newsom, but he does have restrictions going on right now. Is this what all the states need to do? If you could have every state take your advice, Dr. Murthy, would you say that everyone should right now have mask mandates? And should there also be what are called lockdowns? Oh, we can't hear Dr. Murthy. Okay, we're going to get your sound. We don't have your sound yet, so I'm going to first ask. Oh, there we go. We've got you. Go ahead.
So masks work, and they need to be part of the public health measures that every state is taking. Because we're seeing a surge across the country, it makes sense right now for governors to have masks mandates in place. But there's a larger challenge that's being illustrated right now, which is that states in many cases are making their own decisions and systems for when to trigger restrictions because we don't have a clear national alert system that states can rely on, that's evidence-based and tells them when you hit a certain test positivity rate, a certain number of cases, certain hospitalization rate, that these are the measures you put in place. And without that, many states are having to make this up on their own. Joy, there's one last thing that I want to emphasize here, because this is near and dear to me. It's a cost of the pandemic, though, that we're not measuring. And that's the impact and the toll this pandemic is taking on our healthcare workers. And I want to emphasize this because you just earlier in this segment showed a clip of a healthcare worker who was clearly struggling with the impact that this is having and wondering why people aren't taking more measures to protect themselves and each other. And I want to emphasize, many of these people are my friends, my colleagues. They're tough men and women. But many of them are really struggling right now as they once again see this surge that's filling their hospitals and taking their lives. And this psychological injury and strain that's many of our healthcare workers are experiencing, this will stand as one of the most profound costs of this pandemic. And that's why it's so important that we take every step possible to bend that curve, to wash our hands, wear masks, keep distance from others so that we can ultimately reduce the spread.
Yeah, and one of those healthcare workers is you, Dr. Lipi Roy. You're out there in the world doing this. Yeah. Are you concerned that this news about that there's going to be vaccinations available at some point when we don't know when it's going to be will cause people to relax even more and say, oh, good, everything's going to be fine. I can just go ahead and have my Thanksgiving.
Yeah, I'm absolutely worried about that, people are going to just become so lax and say, oh, I've got this pill, this medication, and I can just relax my other preventive health measures. I'm totally concerned about that. But I also just want to follow up on what Dr. Murthy said. Just today, I got yet another text from a colleague, a former mentor of mine, who's now an infectious disease doctor who wakes up at 5 a.m., sees patients with transplant infections, bone marrow infections, who comes home late at night. And she says, I understand people have COVID fatigue, but if you want fatigue, follow me for the last 9 months and I'll show you what tired is.
Yeah, absolutely. And also, we definitely want to big up all of the healthcare workers, down to the orderlies, to the doctors, to the nurses, everybody who's doing the hard work out there and taking huge risks for us. We thank you so much. Dr. Vivek Murthy, Dr. Lipi Roy, thank you both. And up next, former Trump administration official Jaron Smith will tell us what it was like to be a rare, high-ranking black official in the Trump White House and what he thinks about Trump's baseless election fraud allegations. Stay with us.